In this edition of Generations, 2021 marks the 40th year of the first diagnosis of HIV/AIDS in America, and we talk with Dr. Anthony Fauci about this milestone. And Judy Jencks from seniorcenterct.org talks about how we're all facing change in this COVID-19 world. Hello, I'm Brian Scott Smith, and welcome to Generations, a podcast for people of your generation. 2021 will mark the 40th anniversary of the first diagnosis of HIV/AIDS in the US, and although we are dealing now with a pandemic with COVID-19, we cannot forget that HIV itself is also considered a pandemic too. Over the years since the disease was named, millions of people around the world have either lost their lives to the condition or are living with it, and we've seen improvements to medication to control HIV, but 4 decades on, there is still no cure. Dr. Anthony Fauci, who has become known again in the public eye for his comments about the current COVID pandemic, was one of the first medical experts to be drawn into the HIV/AIDS arena back in the 1980s. He helped to spearhead drug testing and initiatives that have gone across the globe as we continue to fight this deadly disease. But despite there being no cure, there are still positives. One of those being people are living much longer today with HIV/AIDS than before. I spoke to Dr. Fauci recently about 4 decades of HIV/AIDS, his personal memories, new and emerging treatments, and how people are aging with HIV. Dr. Fauci, thank you for joining us on the podcast.
Thank you for having me. It's good to be with you.
2021 marks a milestone in this country. It will be 40 years since the first diagnosis of HIV/AIDS. You, of course, are very much part of that landscape. Does it seem like 40 years ago, sir?
You know, in some respects, it seems like forever ago, but in some respects, for those of us who have been involved, as I have been, from literally the very first week when the reports came out from the MMWR, it seems very much like yesterday, because I still have flashes in my mind of those early years, which I'll never get out of my consciousness, of the extraordinary suffering and pain with a new disease that we didn't even have a name for it. And we certainly didn't have a cause for it, but we were just there trying to put Band-Aids on hemorrhages during that time. And then a lot of things have happened in 40 years, many of them really, really good in the sense of therapies and prevention. So yes, it seems like forever and it seems like yesterday.
We're going to touch upon a little bit more of that as we go through the conversation. You've always been, it seems, at the center of people's attention, certainly with the current pandemic. But of course, we often forget that HIV/AIDS is a pandemic in itself. And I want to take you back to your meeting with Peter Staley, who was or who is an activist for ACT UP, and you met him in the late 1980s, I believe. What were your impressions of Peter? Because you're still very much, I believe, in touch with him.
Well, more than in touch with him, he's one of my closest friends right now. So yes, I talk to Peter a few times a week at a minimum. So, the one thing that I got back then for Peter, but also for several of the other activists, were highly committed, very intelligent, passionate people who had a cause that history has shown was an extraordinarily productive cause. But at the time, they were doing uncharted waters. They were poking at and challenging the well-established scientific and regulatory enterprise that had never been done before. So I think when you describe them, Peter included, and particularly because I know him well, but others, Mark Harrington and Greg Gonzalez and David Barr and Jim Igo and on and on and on. I could spend the entire time naming them. There were so many important people. Was courage. I mean, they were very courageous. They were bucking against something that had never before been challenged. So in that respect, even back then, as they were challenging me, clearly more than, they were challenging me. Larry Kramer was trashing me in his own inimitable way. But even then, you had to have respect for them because you knew what they were doing is that they were really on the right side of history right from the beginning.
You yourself were trying to change things as well, because you were trying to invite, obviously, these groups of people, onto clinical trials and things. So you yourself were sort of like bucking a trend, I suppose, in a way as well, weren't you?
Oh, yes, I was. And it was at no small cost, because there were certain members of the scientific and regulatory community who were very upset at me. They thought I was, quote, the word they used office was selling out to the activists, compromising the scientific process, compromising the regulatory process, just to essentially cater to these rabble rousers, as they were felt to be. And I think that as time went on, those people who were criticizing me finally realized that they were not rabble rousers. They were people trying to gain the attention of authorities who inappropriately were not paying as much attention to them. But I definitely had my bumps and bruises from that too, because my own people, many of them in my own organization, were very concerned and upset at what I was doing.
We, of course, sadly lost Larry Kramer recently. As you said earlier in this interview, you had a very good relationship with him, over 30 years of a friendship. How did that affect you?
Well, it was a big loss. I mean, Larry was, an iconic figure who I had a very, as he described it in his own words, quote, a complicated relationship. And it was complicated because it started off in a very confrontative way, him confronting me, not my confronting him, and some of the things that he did to gain the attention of me, which he certainly did gain my attention, as well as for the scientific community. Larry was a very passionate person, very committed. He was an important part of the activist movement because he did not pay much attention to the fine-tuned details of the scientific process. He just was an iconoclast in the best sense of the word. He would challenge everyone and everything. He felt the entire gay community were his children, as it were, his people, his tribe, and he would do anything to protect the safety and the health of those people, and sometimes to the extent that they rebelled against him. You remember when he wrote the book Faggots, there was a big pushback on the part of the gay community against him, but then he became the leader and the hero of the activist movement, and our relationship was very complicated. It started off very confrontative, and then as we got to know each other, we realized, both of us, that we wanted the same end game. We wanted to end this. We wanted to get treatments. We wanted to get prevention. And that's when we became closer and closer. But to his unusual, unique character, even as we became very close and were really, really good friends towards the end, after 10, 15, 20 years, is that he would not hesitate for a moment to just blast me on something that he felt was not being handled correctly. But he wouldn't take it in the sense of doing anything wrong to me. I mean, we've had situations where we would be on television in a panel and he would be blasting the hell out of me, calling me all kinds of names on public TV so that, 10 million people were hearing it. And then I remember one or two or three or more instances when I would get home, walk in the door and the phone would ring. It would be Larry. He said, "Wow, wasn't that a great interview? How'd you like it?" He said, "Larry, you just trashed me in front of 10 million viewers. What do you mean, how did I like it?" But that was Larry. You had to accept him.
You went on to become his doctor later on in life, and also he underwent an organ transplant as well, which you were very much sort of part of. It sort of really set the scene and changed things a little bit for people who were living with HIV/AIDS, because he was quite a lot older to receive an organ transplant, wasn't he?
Oh, yes. I mean, we pushed and found someone for him who would be able to do it. It was quite successful. As you know, when Larry passed, he passed in his 80s. I mean, that is really something for someone who had been not only living with HIV, but who had a liver transplant and was on suppressive therapy for his liver transplant. That's most extraordinary. I think it speaks to the toughness and resiliency of Larry. But yes, I was very much involved in his care and in getting him set up for the liver transplant. But it was the beginning of a very important change in attitude of getting transplants for people who were living with HIV, as opposed to just giving up on them and saying, well, they have HIV, therefore, why should we waste a liver transplant on them? Right now, not only transplants from uninfected people to them, but transplants between HIV infected individuals or persons with HIV.
The other thing I wanted to put to you as well is, how do you deal with all of the attention that comes in your direction? Because, we've just spoken about Larry and about Peter, and they are both friends, but as you've just said, they also challenged you. You're also challenged on a daily basis, by other people who don't know you, but make assumptions. How do you deal with all of that, Dr. Fauci?
Well, if the challenge is valid, you figure out how to address it. And if it can be addressed, you address it as appropriately as you possibly can. If it's just people attacking or, making comments that aren't helpful or productive, then you just ignore it. And I've learned over the years how to compartmentalize and ignore things. I mean, you have to be careful that you do not get distracted from what your main goal is. Right now with COVID-19, my main goal is to develop therapeutics and vaccines to end the outbreak and to serve as a public health official articulating to the general public what they need to do to protect themselves from infection. That's what my entire life is right now. That's all I do. When people do things either in a flattering way or in a threatening way, which I get threatened often, I just consider that as peripheral noise, and I can't get distracted by it. I just have to focus like a laser on what it is that I should be doing.
As we said at the top of this podcast, Dr. Fauci, next year is 40 years of the first diagnosis of HIV/AIDS in the US. Yet still today, we have no cure for HIV/AIDS. We have various other medications and ways to manage the condition. Do you think that we've stepped off the gas a bit when it comes to HIV/AIDS, regardless of the situation we find ourselves currently in across the world, obviously with COVID?
No, I think we continue to push very hard with HIV. In fact, just 2 days ago, we had the announcement of the data from HPTN 084, which was the use of injectable cabotegravir in women. It's, I think, one of the most important advances we've had in a while, because one of the issues that we've been challenged with is that obviously this is a global pandemic. In Southern Africa, it is dominated by the infection of young women. Some of the prevalences among women of childbearing age are striking and frightening, 40 to 50% in some prenatal and neonatal clinics. And we've never been able to get a good pre-exposure prophylaxis program for them. Pills every day, they don't take them as often, or they're put in a compromised position because their sexual partner would essentially rebel against them if they do that. They need a therapy that takes a few times a year that is effective. But we didn't know it was effective until we did a trial comparing it to oral Truvada. And what we found was something extraordinarily gratifying, that injectable cabotegravir in women in 084 was even better than daily oral Truvada. That is a huge advance for the prevention of HIV in women. So we are not taking our foot off the gas pedal when it comes to HIV. We still feel that we need to end the epidemic as we know of it, as an epidemiological phenomenon. In the United States by 2030, we started at 2020, so it's a 10-year program, decrease incidence by 75% in 5 years, and by 90% in 10 years, which will bring us to 2030. I think that's achievable, and I think that we need to continue to push as hard as we can to implement the program that gets us there. So, short answer to your question, we're in it all the way when it comes to ending this epidemic.
We are seeing a reduction in like new cases of HIV/AIDS here in the US and in certain parts of the world. But of course, people are getting older and living with HIV, much more so than obviously back in the 80s, when sadly people would only live for maybe 1 or 2 years. But that in itself will bring its own medical complications, will it not, for them?
Absolutely. And that's the reason why we are paying attention to the medical conditions of people who have successfully beaten HIV. And by successfully beaten, I'm talking about the large, large number of people who are on one pill of 3 drugs a day with an undetectable viral load and a CD4 count that's reasonably good. There are many, many people there who are essentially living normal lives, except that because of the premature aging situation, they're getting many of the comorbidities associated with aging. We can't forget about that. We've got to make sure we care for them and develop better approaches to therapy and prevention of those comorbidities as these people get older. Just because their HIV is under good control with antiretrovirals doesn't mean we forget about them.
Do we still see a lot of stigma, or do you still see a lot of stigma around HIV/AIDS, 40 years on?
Much less so now as a total nation, but there are parts of the country that dominate HIV now. And interestingly, if you look at the heat map of the country, of the infections in different parts of the country, the newer infections are restricted geographically to like 48 out of 3,000 counties in the United States. But there are 7 states in the middle and southern part of the country in which the rural aspect of HIV looms large. So people who are living with HIV, who are contracting HIV, are predominantly an African-American, men who have sex with men, rural population. Under those circumstances, the stigma is very significant. And that's something that, we may have gotten rid of a lot of it, not all of it, in the New York, San Francisco, LA, Chicago, New Orleans area, but it's alive and well, unfortunately, in some of the rural areas. And that's something we've got to fight against.
Is it time, do you believe then again, sir, for there to be a concerted effort to have a very big sort of like public awareness campaign? I mean, I remember back in the 1980s as a young man when AIDS was sort of at its height, HIV/AIDS was at its height, that there was television commercials, there was billboards. I mean, it was plastered everywhere and it was scary. I'm not suggesting that we go to that sort of level again because we know a lot more about HIV/AIDS, but is it time for us to bring the awareness back?
Well, it is, but it's going to be much more difficult back then because I think you used the right word. I remember very, very well. There was fear in the air. Walk down the street in the Castro district of San Francisco, walk along Christopher Street in the Greenwich Village, and there was this palpable feeling of anxiety as you looked around and saw people. You could tell just from looking at them, cachectic with Kaposi lesions on their face. Those were horrible years. I remember them very, very well. I still have a bit of a post-traumatic stress disorder from it, to be quite honest with you. But to get that message across now is needed. Yes, you're right. But it's going to be very difficult because it isn't as scary now as it was then, particularly in light of very good therapy and prevention modalities like PrEP for people who want it, who need it, who use it. We do have to, if we want to end it, we have to have a different kind of campaign. And it may not be a campaign on fear. It may be a campaign on, okay, it's been 40 years now. Let's get this damn thing out of here. That kind of approach, and just end it so we don't have to worry about it in a pandemic way throughout the world, including in the United States. We have 38,000 cases every year, and we've had that for over a decade. That's unacceptable. We got to bring that down. Got to bring it down to a couple of thousand a year at the most for the entire country. 38,000 is orders of magnitude higher than it should be.
Do you think part of that problem, sir, though, is that the healthcare system or the way that healthcare is set up in this country probably needs to be reviewed so that people can actually get access to, these medications, things like PrEP? And also I believe that Medicare itself is changing as well, so that hopefully more people can get access to, medications that way.
Absolutely. In fact, I have a slide that I show about places where there are clinics where you can get PrEP or where their people know about PrEP, and what the distance of driving from a particular area where there's a high incidence of HIV. And like some of them is like 100 miles away. I mean, I cannot imagine. I'm here in Washington, D.C. I could jog out from this building and be in 10 places that I can get PrEP in 5 minutes. And so, I mean, that's unacceptable that people have to get in the car and drive for over an hour to be able to do that.
Final question to you, Doctor, and thank you ever so much for your time. I didn't want to mention COVID, but there is sort of a link to this. As we potentially see a vaccine on the horizon for COVID, do you think that what we have seen by way of pushing to find, a vaccine for this particular condition, could it start to accelerate maybe more of the research or possibly, a vaccine or something else for HIV/AIDS?
Yeah. No, I think the success of a vaccine excites people. Everybody's excited about the Pfizer success, and hang on to your coattails because there's going to be a few more that are going to be successful, and they're going to be soon, like in the next few weeks to a month. I think you're going to hear about it. So yeah, no, I think that you could kind of feel the important impact of a vaccine, and that's the reason why we're putting so much effort in an HIV vaccine, which would be much more difficult than a COVID vaccine, I can tell you.
Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Disease. It's been a pleasure talking to you, sir. Thank you for your time. And I'd like to wish you a happy 80th birthday, which is coming up at the end of the year.
Thank you very much. I appreciate it. Thank you for having me on your program.
And thank you for looking after the public as well for so many years, sir.
Thank you.
And joining us as always is Judy Jencks of seniorcenterct.org. Judy, lovely to have you on as always.
And it's lovely to be here.
So today we're going to be talking about change. That sounds an interesting topic.
Yes, change is defined as the act of making or becoming different. This whole COVID situation certainly has made our entire lives different in a multitude of ways, from the way we stay safe, work, interact, and even make purchases evolves constantly. 2020 has been the all-time master of change, whether we wanted it or not. Who would have ever dreamed we would be wearing masks? In 2019, we didn't even know what social distancing was. Also in 2019, just what could have possibly have been meant by mandatory stay at home and that children would no longer go to school. Even if someone had told you that they were going to make all of this into a movie, many of us would have said, that's all too crazy and no one will ever go and see that. For us, the New England Patriots fan, the biggest 2020 news should have been Tom Brady leaving. Instead, local and high school sports almost doesn't exist. Fans can't go to games. We don't know from week to week which school is opened and which are closed. COVID has changed our world forever, whether we wanted it to or not. Life will never go back to what it was. Now is the time we should be thinking about what we want our individual lives to be like as we move past 2020. What do you want your 2022 to look like? What have you been dreaming of? What did you miss the most? What did you get robbed of in 2020? My husband and I were not able to celebrate a very special anniversary the way we had been planning for the last 3 years. We were going to have a huge party with all the bells and whistles, followed by a 3-week vacation to Vancouver, a cruise to San Francisco, and then on to Las Vegas. None of that happened. And as we all push through these disappointments, don't be afraid to reach out. Express your frustrations, your anger, your fears. Talk to your family, your friends, your doctor, find a therapist. Tell them how hard 2020 has been for you. Then embrace that change, no matter what it might look like. Move forward because now is the time for us to begin making new and different plans for those celebrations we missed. Now is the time for all of us to start planning the life we want to live. As we reflect on 2020, now and in the future, there are things that turned out to be blessings. We can be thankful for the everyday pace of our day-to-day lives slowing down. Great weather over the summer, being outside, rediscovering old pastimes, beginning new hobbies, learning new ways to do things. We can continue to use the present to get healthier, to find new paths to travel, to start planning, to begin working on a 2022 bucket list. What is the thing you want to do the most? What did you miss the most? Start making the actual plan on how you will achieve those desires. Hit the ground running. Be ready to live. Do it your way. Let's make a new start, just like in Frank Sinatra's song, New York, New York.
Great words as always. And are you somebody that doesn't like change?
Me? No, I love change.
Because it's not something that everybody likes, is it? And I mean,
No.
I've been self-employed now for 20 years, so for me, change is sort of a constant. But it does put people off.
Oh yeah, it does, and especially when it's imposed. You know, when you don't have a choice, I think that's when it becomes very, very difficult.
It certainly has been, and as you say, a very interesting year. We could never in 2019 have thought any of this was going to happen, but we've all dealt with it. One of the phrases that obviously has constantly been used in 2020 is the new normal. I find that an interesting phrase only from the point of view that I feel that COVID-19 actually showed us that the normal in certain ways wasn't actually working. So I don't know if we should necessarily be scared of a new normal.
I like that the normal wasn't working, because I almost find the new normal to be an insulting term. Whatever your normal was, it will never happen again. That's all in the past. So to tell me, it's going to be a new normal, that doesn't begin to define where we're going.
And it certainly has shown many systems that we did rely upon, haven't really worked. They've fallen to the side, to the wayside sort of thing. So I think it is a good opportunity for all the sadness that obviously has been brought in 2020 with clearly so many American deaths. And obviously, we mourn all and every single one of those because, one death is one too many. I think it is an opportunity, though, for us, even at this point, as we still wait for, a vaccine, which hopefully will be around fairly shortly and in the beginning of 2021. But it is an opportunity, I think, for us not only to reflect, but hopefully to be a little bit more hopeful for next year.
I think we're headed in a whole new direction, and it can be very, very exciting if we really look at it that way. We need to look at it as a positive thing.
Well, it's been a pleasure talking to you as always. And in fact, this is the last Generations that we're going to be doing for a little while as well. So I just want to say thank you ever so much, Judy, for everything that you've contributed to this podcast for the past couple of years. It's been an absolute pleasure and joy working with you. And, I think we've covered some incredible topics. And of course, we're going out on a high as well, having, of course, interviewed, and you heard earlier, Dr. Anthony Fauci, of course, one of the most amazing people in the United States, and certainly when it comes to COVID-19, but also, of course, we were talking to him about 40 years of HIV AIDS as well. As we say, it's going to be an interesting new year. So I'm going to wish you happy holidays and a Merry Christmas. And as I say, thank you for everything that you've done to make Generations, the podcast, so successful over the past couple of years.
And I really appreciate all you've done to make the Generations podcast what it is. Without you, it wouldn't have happened. I truly appreciate the partnership that we've had and look forward to us revisiting and making some more in the future. And I hope that you have terrific holidays as well.
Judy, ever so many thanks, and you take care of yourself, be safe, and let's all raise a glass and look forward to hopefully a better 2021.
Yes, we're going to have a marvelous 2021.
That's all from this final edition of Generations. It's been great bringing you stories for the past few years, and we wish you all happy holidays, a very Merry Christmas, and of course, a healthy New Year. From myself, Brian Scott Smith, stay safe, and thanks for listening.